Hello and good afternoon, everyone. Thank you for joining us this afternoon. My name is Ron Hoppe. I'm the CEO of Worldwide Health Staff Solutions, and I will be joined this afternoon by Patti Artley, who is the Chief Nursing Officer of Medical Solutions, the second largest U.S. domestic healthcare staffing firm in the country. In the course of our presentation this afternoon, we're excited to share some insights with you, and we'll also be interested and open to taking any questions that you may have or any points that you may wish to discuss relative to anything that may be presented today. We welcome your questions, we welcome your comments, and certainly the opportunity to engage with you. If you do have questions as the presentation is proceeding, please feel free to record those in the chat section of your screen. I have one of my colleagues who is supporting us behind the scenes on this presentation today. She is monitoring the chat feature and will lead us through the Q&A and any questions that we may have. Patti, great to see you. Long time no see. Patti and I just returned from the Philippines on Saturday, so we've spent a fair amount of time together lately. Patti, I was just making some opening remarks and letting our guests know that we'd be happy to engage with them in any questions or dialogue that they may wish to have as we go through our presentation today. So next slide, please. So in our presentation today, Patti and I are going to share information with you on a number of innovative strategies that you can use in your workforce, cost-saving workforce strategies around flexibility, international recruitment, and virtual staffing. We'll touch on how to close the experience gap and maximize team performance on a budget being a key consideration for all healthcare organizations at this time, and ways to leverage global talent and innovative staffing models. So if we can go to the next slide, Patti, I'll turn it over to you to get us started this afternoon.
Thank you, Ron. I appreciate that. So this is a great opportunity for us to set the stage. And we know that things have improved since we think back on 2020 and when all this disruption really happened. But even though we continue to improve, we know that the workforce stabilization is not exactly where it should be. And while we've closed some of those gaps from a numbers perspective, we know that when we look at predictions, we're going to continue to have shortages, not only in nursing, critical care nursing being one of those, but also in our nursing assistants. And we know that if we don't close the gap on both nursing and those individuals that help nurses do their job each and every day, we know that we're going to have challenges in maintaining and continuing to keep them at the bedside. We also know that certain states will have some challenges with providers, even more than others. Those that are highlighted specifically, California, Texas, and New York, have been called out in multiple different venues as having challenges that are anticipated by the year of 2028. So we want to give you a little bit of something to think about as you think through and you listen to our presentation, but really thinking through if you're starting to analyze where you sit today, really making sure that you do an assessment of what are your today current challenges, the supply and demand that you have today, and what are those pressure points that you have. And then really thinking about, from a recruitment perspective, what are your sourcing methods? What are those processes that you have in place? Are they efficient? Are they easy for the end user to utilize? And then when you think about retention, one of the most important pieces that we recognize right now is, how do your teams feel cared for? Are we concerned about their well-being and making sure that they feel safe, both psychologically and physically safe? Next slide, please. And coupling on that, as we talked a little bit about the numbers gap being closed, we know that we lost a lot of experienced staff during COVID and beyond. And we know that we've hired to and filled those gaps with more novice nurses. And with that, that's created this experience complexity gap. And so we want to give you a few ideas on how to address some of those gaps that have taken place. And one of the most important ones is really making sure that you have mentorship programs in place. What we've heard from the new graduates that are coming out, they want to feel like they're cared for and that they have a safe space, somebody that can help mentor them throughout the process after they finish their being precepted, and making sure that we can help them navigate the waters and in a safe space. Really identifying the training that is required, not only making sure that we have our opportunities for them to grow in a residency program, and fellowship programs are really important, but making sure that we're looking at where are those opportunities for them to grow and develop in the training opportunities. And then making sure, as I referenced before, that we're taking care of them, that they are in a supportive work environment. This is one of the areas that new graduates have identified that they didn't feel well prepared for, was that turmoil and the uncohesiveness that sometimes takes place in and amongst the work environment. So making sure that the infrastructure is there for them to be supported. And one of the great opportunities that we're going to further dive into is that international recruitment. When we talk about that experience complexity gap, where we don't have the experienced nurses, international recruitment is a great opportunity where they're coming with several years of experience and help to nurture and invest in our teams. Next slide, please. And one of the first cost-saving strategies that we want to talk about is really that opportunity to be flexible. Our Gen Zs and millennials have shared with us that they need flexibility in their work schedule. They've figured out work-life balance in a way that other generations might not have. And it comes down to 4 different things that they want to make sure. They want to know that we're going to invest in their talent. Making sure that we have an investment in them is an example of that is clinical ladder and professional development opportunities that they're offered to them, that they can seek out and move through the system in a very opportunistic way. And they can grow and develop at their path. Providing growth opportunities is something that I think is vitally important, that our leaders are okay with the fact that individuals are probably not coming like they did before and going to stay in a unit for years on end. They want to know that they have opportunities, and it's not probably only going to be in that area, but that they can grow and develop in our system, whether it becomes through a transitions program, a career pathway, or succession planning, where we identify strong leaders and help cultivate them, or preceptors through the education path or other pathways that will exist. Improving our work environment, as we've briefly touched on before, making sure that they have the resources when things are going awry, that they have somebody that's going to be there and be able to support them in the pathway. Behavioral response teams are a vital part of that, making sure that they have an opt-out with coaches and individuals that can help them really build their skill set to make sure that they are able to take care of their patients and take care of themselves. And then making sure that we're in a technology forward area, and making sure that as we really continue to invest in different technologies, that we're building the infrastructures to build those integrated pathways so that we're linking things together so that it doesn't add to the workload that our care team members or any of the clinicians are doing. So examples of that are making sure that when we're buying new pumps, that we're also building the infrastructure to integrate them so that they're integrating into the other systems that exist today. Virtual nursing we'll touch on a little bit further, but really making sure that they have the opportunity to take some of the workload off that frontline caregiver. And then EMR optimization, making sure that we're paying attention to that infrastructure. Documentation is one of the biggest frustrations that nurses talk about, and making sure that we're optimizing that investment. And with that, I'll turn it back over to Ron to finish up our other cost-saving strategies.
All right. Thank you, Patti. Thank you for sharing your thoughts on flexibility. I know we'll talk about that a little further here in a bit. If we could get to the next slide, please. When you consider cost-saving strategies, a strategy to be considered, I think now more than ever, is international recruitment. Patti commented on in her opening remarks about how workforce challenges may have subsided somewhat from the peak of the pandemic and its immediate aftermath. The fact of the matter remains that across the United States, there are simply more open healthcare positions than there are qualified applicants to fill them. That is a textbook definition of a supply and demand imbalance. And that's the reality that US healthcare employers face today. Sometimes you think, well, we have a recruiting problem, and if we just had a different recruitment strategy, and if we work on our retention strategy, we can eventually fill all of our hard to fill positions. We'll shorten the days to fill, and eventually we'll get to where we want to be in our staffing strategy overall. The challenge, however, is there's simply a greater demand than there is a available supply. And this is where international recruitment can make a meaningful contribution as one part of an overall integrated strategy that includes some of the factors that Patti has already touched upon. So when you think about international recruitment, there's really two approaches to utilizing and benefiting from the skills of clinicians that were educated outside of the United States. One approach to international recruitment, which up until recently I think has probably been the more familiar approach, and that would have been to utilize international staff on a contract or some sort of temp to perm arrangement. But a second approach that employers are increasingly embracing for international recruitment is to recruit these experienced, qualified international clinicians on a direct hire, permanent placement basis. The international pool of candidates is very deep and very strong. Worldwide Health Staff Solutions will be celebrating our 27th anniversary tomorrow. So we've been working with US employers and helping them get connected with international talent for a good long while. And in my entire time, I can honestly say that the candidate pool, particularly in the last 3 years, has never been as deep and as strong as it currently is, as the number of nurses around the world, not just one or two countries, but many countries around the world, are able to pursue and achieve passing the US licensure exam in support of their goal and their dream of being able to live and work in the United States. International recruitment definitely has the ability to boost permanent staffing levels. Whether your organization's needs may be measured in terms of 10 or 20 or 30 registered nurses that you may wish to recruit through international recruiting, or whether you are a regional or national system and your needs number in the hundreds. Just within the past 12 months, we've been able to support clients that have recruited as few as 10 registered nurses. And we've supported clients that have recruited in excess of 1,000. The pool is strong, the pool is deep, and the pool is impressive. But in addition to just giving you the opportunity to add to your staff in terms of headcount, International recruitment also is a wonderful way that you can help diversify the overall experience and expertise within your nursing workforce. International nurses bring not only their unique experience and their unique background, they bring that experience having practiced in environments that are culturally diverse in countries around the world. And that's a meaningful contribution that they're able to make to health systems across the country. For healthcare organizations that are in growth mode, if you are planning service line extensions, perhaps facility expansion, new construction, perhaps acquisition, international recruitment can very nicely support any growth strategy that you may have in a local market, in a regional market, nationally. Again, whether you're looking to recruit modest numbers or very significant numbers, integrating international recruitment as one part of an overall strategy can provide you with a predictable pipeline of talent. When you also look at international recruitment, particularly on the direct hire model, where you are paying these international nurses at the same rates and extending the same benefits as you would pay to all similarly qualified domestic staff, when you consider that fact together with a flat fee for international recruitment services, you will find that you are able to achieve a lower hourly rate or a lower hourly cost versus traditional contract staffing. Again, this is not to say that contract staffing doesn't have a very important role to play. It certainly does, but all things in their proper measure and proportion. And to the extent that international recruitment can help you, we normally recommend that employers think about somewhere between 15 to 20% of current plus anticipated openings can be well supported through international recruitment. There is a very meaningful financial cost-saving opportunity to be had. International recruitment, as I said several times now, should be part of an overall strategy. It's not a project or a one-off type of effort that's undertaken to address a current issue. It's an opportunity to implement another tool or add another tool to your toolbox that allows you to build, establish, maintain a pipeline of candidates over an extended period of time. Once a pipeline is established, nurses work their way through that pipeline, through the immigration process, the relocation process, and start to arrive in the U.S. And while those progressions are taking place, you have the opportunity to continuously reevaluate your current and anticipated needs over time and continue to add to that pipeline so that over time you have a very predictable source of well-experienced candidates that you know will be joining your organization. And as Patti talked about caring for the workforce, I think integrating international, in fact, is another way that you can do that. International recruitment signals to existing staff that help is on the way, tangibly. These are individuals that have been hired. They're going through the process. And of course, as international nurses start to arrive and your overall staffing levels and vacancy rates normalize to a more acceptable level, it reduces overall workforce stress and burnout, improves morale, all of which ultimately contributes to reduced turnover. So international recruitment brings many opportunities, many benefits, both qualitatively and quantitatively. And if you have never had the opportunity to work with international recruitment as part of your strategy, it's something that we would certainly say requires close examination and I think is a very viable option for many healthcare organizations in the country today. Patti, I'll turn it back over to you with our next slide.
Thank you. So now we have the opportunity. The other cost-saving strategy that we've identified is virtual care. And that's really a full complement of whether it's patient sitters to keep the patient safe and really do it at an economical cost, or is it virtual nursing to help alleviate and support some of the roles of the nurse and really allow them to practice to the top of their license. Virtual nursing has really proven to increase and improve patient outcomes and satisfaction, as well as nurse satisfaction, decreasing turnover and burnout by reducing some of their tasks that are on their plate. It really does allow seasoned nurses to help our more novice nurses. We talked about the experience complexity gap and layering on those experienced nurses to help them not only tell them what to do, but help them critically think through the processes through appreciative inquiry, helps them grow and develop professionally. Really helps reduce costs overall by really utilizing your resources efficiently, and really has complemented many of our colleagues who have implemented virtual nursing have talked about the fact that it has allowed them to keep their nurses at the bedside, or allowed them to keep their nurses in the workforce for a lot longer by providing virtual care. And then overall, it really truly does enhance the balance, the work-life balance for nurses, allowing them to practice in a very different way. And I don't think we can highlight that enough, that it really has complemented the care of the nurse at the bedside. It doesn't take anything away from that, but it's really a complement of that care, improving the communication, safety, and quality of the care that is being provided through virtual care. Next slide, please. And then this is really an opportunity for us to think about implementing these costs, and this is a summary of what we've just talked about. It's really bucketed into 4 different things. It's important for you to do your assessment and make sure that you recognize, where are your biggest gaps? What are those things I'm trying to solve for? Layering in flexibility and retention strategies in your planning is vital. It's not just a short-term and a long-term strategy. It's really thinking about, how do I layer on the career development, the professional development that needs to take place, that mentorship that we talked about, making sure that we're providing a lot of different options for our team members. International recruitment, as Ron so eloquently talked about, it's really that long-term strategy. And you might not have that opening today. This isn't about the short-term strategy. This is layering on that long-term strategy so that you can continue to evolve and keep your staff at an experienced level that's very high. And then virtual care as another option for a strategy to layer on, how do I help cultivate, coach, and develop? How do I help make sure that we are continuing to grow our staff and provide the safest level of care, removing some of those tasks and some of those opportunities that we can do outside of the bedside? And these are the 4 big strategies that, when you think about how to most cost effectively come up with strategies to help support the care at the bedside, these are those 4 things that we've identified. Think through, as you're making your plan and your long-term recommendations for your organization. You're not going to deploy all of these, but what are your biggest needs? What are those problems you're trying to solve? And then, how do I deploy these in a short-term and a long-term strategy format?
Well, thank you, Patti. Great insights, great ideas. Just, I had a couple things I just wanted to maybe discuss with you a little bit further before we wrap up today. You had spoken about flexibility being a key to retention, and I know you're, and virtually a daily basis in contact with and speaking with CNOs across the country. What would be some examples of really interesting and innovative things that you've heard of health systems or employers doing to add to their flexible approach to their workforce?
Yeah, there's a few of them. I love the new seasonal work. So this is the opportunity that when you have seasonal influxes, those opportunities to layer on nurses, and they work full time during the high season and part time to no time during the low season. There are several of our partners have deployed something like this. They've deployed it in a little bit different way, but it has really, some of them go full time from the beginning of October when flu season starts, and then they staff full time until April or May. And then after that, they either work one shift in a 2-week pay period or none, and they get a 0.6 or part-time benefits, and they get paid during that time for the hours that are worked, but they pay their benefits at a part-time rate as well. So it really is a great opportunity for flexibility. It helps you manage your workflow in those areas that have episodic and seasonal influxes. Some of the other things that we've had or we've seen are really around looking at where are your biggest churns. And instead of challenging yourself to staff the exact same way all 24 hours out of the day, is really layering in an intermediate shift or even an 8-hour or 4-hour blocks covering your highest churn, getting people lunches and breaks, and allowing them to cross cover when people are leaving, but also really making sure they're doing the admissions, discharges, transfers, those high touch points that you have, and really layering them in at different times. So those are two of the big ones that I'm seeing deployed in a lot of different areas.
Okay, great. And just lastly, Patti, you had spoken on the on the opportunity and the potential applications of virtual care. And I know it's still really a rapidly emerging part of the new care delivery models that are evolving daily. What are some of the primary applications in the clinical setting that you see for virtual nursing?
Well, what I see most often being deployed is probably just scratching the surface. And as technology continues to evolve, I think we're going to see this go further and further. In the med-surg area, which is where most of it is being deployed, it ranges from admission, discharge nurse, they do education, the second set of eyes on admission, or daily assessment, they do med reconciliation, care planning, communicating with families. That's what I see primarily being done in the med-surg areas. And then we have several hospitals that are working in the ICU setting on EICU, where they are actually working with other hospitals. So they may be the academic medical center or the larger community hospital, working with several regional hospitals that actually help manage and stabilize their patients, whether it's waiting for transfer or it's helping them really keep the patients there in the community a lot longer than what they would have in the past. So those are a few of the things that I see most often in the partners that we're working with.
Right, great. Well, Patti, thanks for joining me this afternoon. It's been a short but information-packed conversation. I hope that our guests have found at least a portion of this information to be helpful to them as they look to manage their workforce today and into next year and into the future. We would be delighted to hear from you if you do have further questions or would like any additional information on the services provided by Medical Solutions or Worldwide Health Staff Solutions. We thank you for joining us today. We look forward to having you join us on a further webinar presentation. Just stay connected with one of our social media channels. That's always the best way to get the latest news of webinars and other events that we have coming up. We look forward to seeing you all again. Thank you for joining us today. Bye for now.